It's not fine enough actually. It doesn't give the gush. Should give in the first brick. No. It should explode actually.
Yeah.
Let that come up. Let's see how this behaves. വരുന്നുണ്ടല്ലേ ഇത് കിട്ടിയായിരുന്നോ It's not. It's just always a trial. You can't standardize it. But then and yesterday we were fooled by it actually. We were fooled by this yesterday. It is black. It is black. Definitely. The problem with this is that even though it's a quick result showing therapy, we can't do it like the way we want it, like all the time. Whatever it is, it's a blood tissue that is coming out. Good or bad is a different story.
So you need to allow the body time to get used to release the blood.
Yeah.
So you would say like maybe 3 days? Or?
Minimum, generally. But then you see, when there is the hell of a situation, then no rules are taken. It's just the relief that matters overall. You see now the color change is happening to a bit, I would say. Actually, this is the ideal method. What we did yesterday was a compromised method. Usually with the leg, it's always stab and this like gravity. But then പിടിച്ചോ നിങ്ങൾ പിടിച്ചാൽ ഞാൻ ഒന്നും ചെയ്യുന്നില്ല ഇങ്ങനെ വെക്കാം കളർ ഒരേപോലെ ഇരിക്കുന്നു അല്ലേ വേറെ ലൈറ്റ് കൂടെ ഇല്ലാണ്ടോ അല്ലേ പക്ഷെ പല വരുന്നുണ്ടോ torch correct. I'm just looking for how the still dark actually and frothy of course. The color gives us a good clue of what is vitiated.
So what clues do you then take to know how many times you have to do it?
This one repeatedly. What course?
It's just like depending if the swelling comes down, you know, you don't have to.
Actually, it's the pain that decides everything. Because swelling we still can afford with some pace and it can just subside. The pain is something that is the indicator that the system just. The pain is actually a method of releasing. Like when even a kidney stone starts to be coming to the ureter, just get me out of here. Kind of a feeling, and that it just hits anything. So it's the worst pain at that point. It is stopped much earlier than the other day yesterday, no?
But would you say there was more flow initially?
Yeah, definitely it was. But yesterday was more, I would say, because yesterday we went till this point, no? Easily. We had up to this much blood.
But I think as well, yesterday, once you released the rubber band, it continued to flow again.
They started again. Which we will see today also. Now once the drops just stop, and then we will. Actually, there are also methods we do there. No, we get a very simple, very smaller needle kind of. There are many methods we do it. This is a big bore actually, a needle, but it helps you gush, lot come out. Because in some of our institutions we make like a, what I would say, a sort of beaker, and we add anticoagulant to it and we measure kind of. But the way I work, I just do it quick kind of. There are in institutions which are like hospitals. If I'm in a hospital, I would just use that luxury of more people, more timing. And I would just come to the point of giving a prick. That's it, kind of. But when it's dispensary, even the camera is in my hand. There's nobody to do it. Yeah. So because the bystanders, they don't want to see it actually. Those who bring, they say, "Doctor, you do it," and then we will come. We will come out. Whenever it is done, you let us know, and we will know. They don't like the blood sight actually. So then, what can we do then? Since every invasive procedure we need to document, so we have no other option. Sorry. We can expect something more to.
So you use measuring the pulse less as a...
Yeah. Our style of it is more of the symptoms, and of